The human skeleton is a dynamic framework. It bridges morphology with precise function. At the core, osteons drive tissue renewal. This is the 206 bone system.
The axial skeleton establishes the central vertical axis. In contrast, the appendicular skeleton facilitates locomotion.
Long bones like the femur have a shaft and two ends. Short bones, irregular bones like vital organs. Irregular bones like complex shapes. Sesamoid bones protect tendons from...
Long bones are defined by a length exceeds their width. They consist of a cylindrical shaft and two rounded ends. Their primary function is to act as levers for movement. Examples include the femur, tibia, and phalanges.
Let's talk about short bones. They are cube-shaped, providing stability with limited motion. Think of your carpals and tarsals. Flat bones are thin, flattened, and typically curved plates. They protect internal organs and provide large areas for muscle attachment. Examples include the sternum, ribs, and cranial bones.
Irregular bones. They have complex shapes with various processes. Examples include the vertebrae, providing protection and support, as well as the maxilla and sphenoid.
Sesamoid bones are pretty unique. They're small, seed-shaped, and embedded in tendons. They protect tendons from stress and increase muscle leverage. The best example is your patella, or kneecap.
Long bones function as rigid bars. Short bones provide necessary stability. Flat bones act as biological shields. Irregular bones protect the spinal cord. Sesamoid bones serve reduce friction. Osseous tissue is classified as compact or cancellous bone. Compact bone is dense and highly organized. Cancellous bone forms a porous, trabecular network. Compact bone is dense and resists compression. Cancellous bone is a lattice that minimizes weight. Bone tissue varies by mechanical demand. Compact bone in the shaft withstands stress. Spongy bone at the ends absorbs shock. The petrous bone is the densest element and best for ancient DNA.
Compact bone is the dense external layer of all bones. Its basic unit is the osteon, or Haverscher forms the diaphysis of long bones. It makes up 80% of the skeleton.
The skull's 22 bones are united by immobile sutures. It is divided into the neuro and the viscerocranium. 8 bones form the neurome, housing the brain. They form via intramembranous ossification. The frontal bone forms the forehead. Parietal bones form the roof and sides. Temporal bones are at the sides and base. Its petrous portion is densest.
Located at the posterior and inferior aspect of the skull, it contains the foramen magnum, all other cranial bones. Located between the eyes, at the nasal cavity walls.
The facial skeleton has 14 bones. Maxillae form the upper jaw. The mandible is the only movable bone. It articulates at the TMJ.
Zygomatic bones form the cheekbones. Nasal bones form the bridge. Lacrimal bones are in the medial orbit. Palatine bones form the hard palate. Inferior nasal conchae are within the nasal cavity. The vomer forms the posterior nasal. Auditory ossicles connect the tympanic membrations to the inner ear. The hyoid bone is suspended in the neck. It provides a critical attachment for muscles.
The axial skeleton is the central core of the body. It consists of the vertebral column and thoracic cage, supporting the weight of the head and upper body.
The cervical region of the spine contains 7 vertebrae. Designated as C1 through C7, they are the smallest in size. They feature transverse foramina and distinct bifid spinous processes.
The thoracic region is the center of the spine. It consists of 12 vertebrae. These vertebrae are unique with the ribs. They feature long, inferiorly pointed spinous processes.
The lumbar region consists of 5 distinct vertebrae, designated as L1 through L5. They feature the largest bodies for weight-bearing, characterized by short and thick processes.
The vertebral column includes the sacrum. Located at the base, it is a single triangular bone. It is formed by the few S5. This structure connects the spine to the pelvic girdle.
Let's examine the coccyx, a single bone formed from fused segments. It consists of 3 to 5 fused vertebrae, known as the vestigial tailbone. The spine features 4 natural curvatures. They enhance flexibility. The atlas and axis enable head motions. The axis serves as a pivot for rotation. The thoracic cage protects the heart and lungs. It is composed of the sternum and 12 pairs of ribs. Its structure maintains flexibility for breathing.
True ribs attach directly to the sternum. They do this via their own costal cartilage. False ribs do not attach directly. Ribs 11 and 12 are floating ribs, with no anterior attachment.
The upper limb. The pectoral girdle consists of the clavicle and scapula. The arm is the humerus, radius, and ulna. The humerus articulates at the elbow. The radius is on the thumb side.
The hand contains 27 bones, allowing for intricate manipulation. The scaphoid is most often fractured. Each finger has 3 phalanges, the thumb has 2.
Lower limbs are built for weight-bearing. Each hip bone is formed by 3 fused bones. The female pelvis is typically broader. The femur is the largest bone. It fits into the acetabulum. The lower leg features the tibia and the slender fibula. The foot is composed of 26 bones. 7 tarsals form the ankle, with 5 metatarsals and 14 phalanges. Bone is a dynamic, living tissue. Osteoblasts form the new matrix. Osteocytes sense mechanical strain, while osteoclasts resorb it. Most bones develop through endochondral ossification. Growth occurs at the epiphyseal plate. When this plate ossifies, ceases. This complex framework of 26 bones provides the body's scaffolding.
This petrous part preserves ancient DNA. Synovial joints are designed to minimize friction.
The skull sutures are immovable joints. Premature fusion leads to increased pressure. Bone remodels based on demand, known as Wolff's Law. It is a living architecture that adapts